I've got a very rewarding job. It's a difficult job. I think you have to keep a lot of plates turning in the air at the same time, but when it all works well, it's extremely rewarding. It's very nice to, I think the most important thing is that we have managed to gain a reputation both amongst our patients and most importantly amongst our peers as a place where things get done properly. And so when a patient comes to see us, we are already at a level where the patient knows that they're coming here for something reasonably special. And when they commit and they trust us, I think that actually in itself is a very big source of professional pride. When somebody says, like, I'm coming to you because of your name, because you're LCIAD and you're known for doing what you're doing. That has taken a long time to build up. So you've known me for a long time, and the thing that you know is that we're very consistent in our message. We don't chop and change. We don't change our ethos because it's who we are. You can't really change who you are. On the one hand, you can say, well, it's not the biggest practice and we don't make the most money. And it's like, well, yes, I'm not really doing this as a business. It has to run as a business, of course. I don't really do it as a business. I do it because I want to set up an environment where I get to do what I love doing. And I like passing it on to other people and working with colleagues who have got complementary skill sets where we really all have the same ethos. We all fit in that same bubble where we want to do the same thing. And you don't get to work at LCIAD unless you have that ethos. So people are chosen not just for their clinical skills, but for their ability to be human and build rapport with the patients and engender trust. Trust is the ultimate professional pride. Someone comes to you and says, I trust you because of your reputation. That for me is the biggest source of pride, and it's something that is actually the thing that takes the longest to build and is the easiest to damage if things are done the wrong way. But it's a very rewarding job, and especially as we document what we do and we look at things long term. Especially also with our laboratory technicians, people forget the fact that our laboratory technicians really do the work that most people see. We do all the biological stuff, but the aesthetics and the care and attention with all of the laboratory work is really our laboratory technicians' work that you're seeing. So that teamwork with my nurses and my administrative staff and my colleagues and my technician is a very, very important relationship, and that makes it rewarding when you've done the same thing with the same people for a number of years and you all bounce off each other. It makes the whole thing greater than the sum of its parts. That's the most rewarding thing.